kind of tell us, what are some of your longer-term goals right now?
Well, I think the longer-term goals of the organization is to have a higher profile in public awareness. Certainly we're here today. We'd like to push the idea of the drive for COPD. Linda can talk about this at length, but COPD is the only leading cause of death that's on the rise. And what's insidious about it is the damage to your lungs from smoking and the irritants is long-term. So you don't notice those progressive changes. Most people don't take action until the changes have gotten bad enough that they notice that they can't walk as far as they used to without becoming short of breath.
Is this, and just to help me understand, is this damage reversible, or is it pretty much permanent?
Well, most of the damage is not reversible. Some of it can be. There's chronic inflammation from the smoking that occurs, and you can reverse that, but some of the damage is not reversible. But if you don't stop smoking, the damage is going to continue. And a lot of people aren't aware of this, and part of the reason that we were at the Puyallup Fair was to conduct screening and do spirometry, free spirometry, so that people could perhaps get diagnosed and get into a tobacco cessation program and get proper treatment.
Very good. Yeah, that's. I hadn't even realized that might be one of your motivations. I just assumed it was kind of a something to kind of get people involved, but and I'm sure that was part of it too.
Well, you know, it was nice that the Puyallup Fair organizers offered us the booth, and kudos to Linda. She organized it, and she browbeat everyone to giving up their time, but it's for a good cause.
Well, Linda, Carl gave you kind of an open there. So, did you want to go more into COPD and describing that condition, or?
Well, I think the one thing I'd like to say about COPD is that there is a multitude of patients, or the general population, that may have COPD that they don't know it. They may wake up in the morning and it may be hard to breathe, and they may ignore it, and they may continue smoking. So what I'd like to promote is for those people to go to their doctor and get a plan, get some spirometry done, and figure out if they have COPD, so then they can perhaps manage it a little bit better.
And just so everyone understands, what is spirometry? I even said that right.
Spirometry, that's exactly what we provided at the Puyallup Fair. It is a simple breathing test where we measure how big a breath people can take and how fast they can blow out the air. And from that data, the doctors can look at the numbers and come up with a diagnosis of COPD.
Even in early stages?
Sometimes even in early stages, if people have mild obstructive pulmonary disease, that can be picked up with simple spirometry.
Let's talk about smoking. Are you involved in any smoking cessation programs, and how successful have they been, if you are?
Well, I actually was involved in a smoking cessation program where I worked, and saw many, many patients. I was actually trained at the Mayo Clinic to help people quit smoking. And what I found over the years is that people really have to want to quit smoking. That's probably the one most important factor about quitting smoking, is you have to have that desire. And secondly, if you have that desire and you're willing to work at it, you can quit smoking. You can quit smoking with having a plan. In Washington State, there's a quit line that you can call that's free. I didn't bring that number with me, but we can provide it to you. People can call and get free advice and a plan for quitting smoking anytime.
Well, I would certainly think anyone who smokes would want to take advantage of that, especially if how much damage from smoking could be reversed by quitting, say, within a year?
That is a hard question to answer, but generally, if people quit smoking, it depends on how long they've smoked for. So if they smoke for 50 years and they smoke 3 packs a day for 50 years, it's going to be different than somebody that smoked for 10 years, 1 pack a day. I think generally speaking, anybody that quits smoking is going to improve their lung health. Some people more than others, but certainly if you quit smoking, you're going to breathe better.
That's true. And your breathing probably isn't going to hurt as much.
Exactly. You may not be as short of breath.
Well, go ahead, Greg.
I just have something to add with regards to the drive for COPD. People can go to drive for the number 4 COPD.org, and one of the things that we're promoting is if somebody is at the age of 35 or older and who has smoked, there's a small screening tool. I think it's 5-6 questions in length that kind of gives an idea if they're at risk of having COPD, and they can take that to their primary care physicians and get a follow up, as Linda was talking about, getting their spirometry done.
Right.
So it's kind of a nice screening tool, and that's one of the things that we're trying to promote, and that's what we are promoting as well at the Puyallup Fair. That's kind of our big push with not only our society but our parent organization, the AARC, is doing this drive for COPD.
Right. And the other thing I'd like to just add to that is that even if you don't smoke, but you have people in your home that smoke around you, secondhand smoke is causing lung disease just as much as if you're smoking. So,
and especially probably with children.
Especially with children, because their lungs are smaller. So don't smoke around your kids. If you do smoke, please quit.
Well, I know everyone's heard of the American Lung Association, and I'm just curious to know if you if you are affiliated at all with them or do any work with them or any other organizations that either promote lung health or some other medical related thing.
Our parent organization, the AARC, has some. They share some resources, as I understand, and and there's a lot of communication at that national level. As a local organization at the state level, most of our liaison has been with the Washington Thoracic Society, which is the professional organization for pulmonary physicians, which are lung doctors, lung and critical care doctors.
Are you involved in any kind of fundraisers for your organization?
Not at this time. No, most of our financial is we're nonprofit, so most of our finances come from we get a small amount from our parent organization through membership dues that people pay into but most of our money comes from our educational seminars that we provide our respiratory therapists for the state.
And we have to, the economy is not very good, so we have to be very mindful that we don't overcharge our membership for the educational. So we basically make enough money from these educational events to use for seed money for the next one. So we're kind of a small organization.
Lean and mean.
Lean and mean, exactly.
Well, help us to know what should someone do. Let's say someone does have a relative, or they themselves are suffering from some kind of breathing condition, COPD, asthma, or sleep apnea. What is your recommendation to them? What do you tell them to do?
See your doctor immediately. That's number one.
I think having a good primary care doctor that you can go to and talk to, and a lot of people don't want to say, oh, I'm having a problem breathing. That's about the last thing they want to talk about. So I would encourage people to let their doctor know if they're short of breath going up a hill, or they're just laying around the couch more than they used to go see their primary care doctor and get a plan to start feeling better.
Do you make any specific recommendations for doctors to people, or do you kind of stay quiet on that?
For the most part, we want people, if somebody is more comfortable go seeing, say, a nurse practitioner or a naturopath, we feel it's important that they actually go see somebody rather than strongly direct someone to go see a pulmonologist or a lung doctor. What we want is for people to get taken care of, and so if that for them happens to be a nurse practitioner or a primary care physician, then I think that's for them would be the best thing to do.
So what is your website again?
Our website is RCSW, which stands for Respiratory Care Society of Washington.org. So pretty simple.
RCSW.org.
Correct.
Well, folks, I want to thank you so much for being on today.
Well, thanks for having us.
Thank you.
We appreciate this opportunity.
And I want to thank you for listening to today's conversation with Greg Carter, President of the RCSW. We'll be on next week at this time with another passionate voice in the community who is changing the sound one life at a time. So until then, remember to shine a light and stay sound. Thanks for listening.
You've been listening to Spotlight on the Sound. If you would like more information on any of the guests or organizations featured on this program, or if you have recommendations or suggestions for future programs, please email webmaster@salemradioseattle.com or call 206-443-8200. That's 206-443-8200. Thanks for listening today, and join us again next week at the same time for Spotlight on the